Hello, New Bethel Missionary Baptist Church. Thank you so much for the invitation to take part in this, your second annual health symposium. I'm very honored to be here and sharing this short time with you. And I thank Mrs. Helen James and all of you for the invitation. I hope in these short 15 to 20 minutes to go over with you what lifestyle medicine is doing in the community to reduce the burden of chronic diseases. This time together will be for education and higher awareness and not meant to diagnose or treat anyone. So let's get started. My inspiration for becoming a lifestyle physician started early in my career when it became clear that I would be stressed doing conventional medical care. I had no time to connect with my clients. I had no time to help them transform, and I had to turn to exercise and bodybuilding to maintain my own sanity. So I kept the bodybuilding and changed the practice of medicine. And I now today practice lifestyle medicine, which is helping to transform people. And I use my nutrition knowledge from the professional bodybuilding career to help clients reclaim their health using food alone, and then later a little bit of fitness and fun. I've been doing this a long time, and transformation is my specialty. And I love to see before and after photos of healthy transformations and let you know that it is possible. This client had a promise made to her son that she would become healthy, and she followed through on that promise, and today continues to be in the healthy lifestyle. I'm going to share with you how this was done and some of the conditions that lend themselves to lifestyle medicine. If you've never heard of lifestyle medicine before, it is a newer specialty of medicine, started about 2004, and it uses the six pillars of healthy sleep, nutrition, movement, stress management, avoiding toxins, and staying connected in community to help people get healthy and remain healthy for the rest of their lives. I'm going to focus today on the four common conditions that contribute to what we call heart disease, because that is still the number one killer of Americans and very rampant within our communities. Obesity, high blood pressure, cholesterol, and diabetes. If anyone here today knows someone or suffers from one of these chronic conditions, this talk is for you. These conditions form the basis of what we call modifiable risk factors for heart disease. It means they can be changed. You have the power to alter these conditions and reduce the risk of heart attack or stroke. We don't have to be dependent on excessive drug and prescription medications. The population is continuing to get sick despite the booming drug industry. So there's got to be a better way. What if type 2 diabetes was optional? Well, it is for some people using lifestyle. This is an example of a 76-year-old female, mind you, who decided that she was no longer going to be a diabetic. Once that decision was made, she also decided that she was going to do it by using a healthy lifestyle and came to work with me, and together she accomplished her goal. She started out in 2021 with an A1C of 9.7, and she worked and learned and applied what she learned and dropped her A1C down to 7.4. This type of change, by the way, usually takes about 3 to 6 months in most people. And if there is a little bit of complacency or life happens, holidays, it may take a little bit longer. However, she reached her goal by continuing to work on this number. Her A1C further dropped from 7.4 down to 6.4. And many of you might know that coming down to 6.4 means that she was no longer a full-blown diabetic, that she went from being a diabetic to a pre-diabetic. And in fact, today she has continued to work on her health and is no longer a diabetic. She came off medication that she was originally taking, And this was all done without prescription drugs. Same is true for cholesterol. What if some of you wondered about eliminating cholesterol from your life? There are some forms of cholesterol that can be completely reversed and normalized with nutrition only. A typical example here is someone who starts at a cholesterol level of 200, in this case 204, that goes down to 140. LDL or bad cholesterol of 138 that goes down to 76. This is possible and done every day in my practice. This type of change takes less time, usually about 2 months to 3 months. So I'm going to show you a more detailed example of a 53-year-old woman who came in wanting to be healthier, reduced her weight because she had had a health scare in the form of a stroke. Her goal was to lose 30 pounds, decrease fat, decrease cholesterol, and improve inflammation. And we started working with a meal plan. We did have some advanced knowledge about her body composition, which included a visceral fat, which is the deep-seated fat of 12, double digits. We don't want that. And she also had very low skeletal muscle. This 36% should be about 50% of our body in muscle mass. So we went to work. By the second week, she had dropped some pounds pretty significantly, 6 pounds. Her visceral fat was moving in the right direction, and her skeletal muscle as well was going up. So third week, she continued to work. And again, we were watching for a visceral fat drop and muscle increasing. We don't want to just lose weight and not be healthy. We want to lose weight and become healthier. That means improving body water. We're not just dehydrating ourselves, and maintaining or improving muscle. Muscle should be going up even while we're losing fat. That's the holy grail of bodybuilding. So we worked for a few weeks together. This is what it takes to lose 10, 20, or 30 pounds. Consecutive weeks of work. These are the first 4 weeks. As you can see, she went from 188 to 178, so she lost 10 pounds. In that time frame, her muscle came up from 36 to 38. And in her second month of work, she lost another 8 pounds, went from 178 down to 170, and her visceral fat went to single digit for the first time, from 12 down to 9. These body composition metrics are important to follow during any weight loss process because it's not just about, quote, losing weight. You actually want to become stronger, healthier while you're losing fat. This person went on to work another 4 weeks, so she totaled 16 weeks of work. And I will show you that in the end, she had lost 31 pounds. Remember, she started at 188. She ended actually lower than 157, but this accomplished her goal. She went from visceral fat of 12 down to 7. And she started at a metabolic age of 56 or 58, if you remember. She actually is 53 years old, and her body actually now reflects a more accurate age for her. So she journeyed for 4 months, 16 weeks, but kept the health benefits for years because it's been a few years since her journey, and she's still doing well. What is this called? These types of partnering with patients very intensely, week by week work is called lifestyle medicine. As an intensivist, I get to do the reversal of disease work that I love and enjoy and that people get to benefit from. The most common conditions that are helped by lifestyle medicine include heart disease, blood pressure, cholesterol, diabetes, and obesity. So we're making more and more drugs in our society because we have a lot of medical problems. However, we also notice that severe obesity is continuing to rise faster than moderate obesity, for example, and that kids, childhood, and adolescents are actually getting more obese at a fast rate. So more drugs aren't the only answer, although they are providing some support in the community. So why is it that drugs aren't the only answer? Well, they target appetite, which may help as a short-term solution. But if that drug isn't continued and the appetite that was suppressed is now normal or even heightened. A lot of people unfortunately find themselves gaining more weight than they originally were, and they still haven't solved the underlying problems that caused the issue to begin with, like sleep deprivation, stress, processed foods. They don't know how to eat for life. They don't know how to deal with environmental toxins. And so, with the underlying root causes never being addressed, the persons are left unequipped to actually deal with the problem. So the number of heart attacks per year is continuing to rise. A person has a heart attack every 40 seconds in the United States. And in some places, we see that that statistic is even worse. One person every 36 seconds dies of a cardiovascular condition in the US. Heart disease is on top of every other condition as the number one killer of Americans. And I mentioned the things that contribute to heart disease include high cholesterol, blood pressure, diabetes, and obesity, all of which are modifiable. We can do something about them. Even cancer, which is a very concerning condition, is second to heart disease deaths in the nation. So all of us have someone who is affected by heart disease. 1 out of 3 women die each year of this condition. And if we have 3 people, men in a room, 2 of them will have cardiovascular disease in the United States if they're adults. In the Black community in particular, high blood pressure is the highest among Black men in the world. And Black men tend to die younger of cardiovascular diseases, and they represent a majority of those who are on dialysis today. So, because they're mostly affected by these conditions, it's important to take note and to act when the risk factors can be addressed. The same is true for Black women, that they are overburdened with conditions. The high blood pressure, for example, is often undiagnosed or undertreated in Black women. They have a particular propensity towards heart failure, unfortunately. And we do also have a higher burden of type 2 diabetes. The visceral fat that is carried in excess among Black women can lead to things such as inflammation, which is implicated in other conditions like cancer. So we have a lot of disease burden. I consider disease like debt. It will continue to cost more and more if it's not addressed on time. And it can keep us distracted from the more important, valuable priorities in our lives, like spending time with family members and preparing for a more vital, healthy older years. So, what leads to so many heart attacks and so many deaths from heart disease? Well, let's look at the risk factors. Again, obesity, physical inactivity, high blood pressure, cigarette smoking, which I know isn't as common anymore, high cholesterol, and diabetes. So, if you identify any one of these factors here, there is a potential risk for heart disease in the case. The good news is that heart disease is 80% preventable, and it's important to know how to prevent it. We don't have to be a statistic, and the first way to gain control of our cardiovascular health is to know our number. I say know our number, and I mean specifically to know what is the actual risk of heart attack or stroke in your current situation. We'll calculate it briefly together. And if you have questions about this, you can reach out to me directly on my website, lifestylemedicinesarasota.com. And if you go to Google and put in your ASCVD, this is the atherosclerotic cardiovascular disease risk, you'll find a few calculators. Choose the one by the American Heart Association, AHA, or the American College of Cardiology, ACC. There's a combined calculator there that will be very helpful and accurate. You plug in your age, gender, cholesterol number, good cholesterol, blood pressure, diabetes, and smoking status. And the calculator will put out a number for you. Now, I've done this for the case that I will share today, and it's for a 60-year-old male with a cholesterol of 193, HDL of 48, and blood pressure of 190 over 100. At the time, he was very high blood pressure, and he's much better now, but this was his risk when we hit calculate. He was on medication and he didn't have diabetes. So the calculator showed that he had a 19% risk of having a heart attack or a stroke in 10 years. This is a very high risk. Ideally, you want to be less than 5 or even 0 if possible. So having a risk of 19% is high. And it's the left column here that represents my patient's risk compared to another person who might be his age but not have his risk factor. So again, any number higher than 7.5 is considered intermediate risk and requires a statin. That is an option, or the person needs to do something to reduce the risk if they don't want to be on a statin. If you have questions about calculating your risk, again, I am happy to help you do that. Just reach out to me on the website here, and I'd be happy to freely give you a 10 to 20-minute session on how to calculate your risk so you know your number, okay? If one of those risk factors that we mentioned contribute to heart disease happens to be blood pressure, it is the single deadliest of the risk factors. Anyone with uncontrolled high blood pressure will have a higher risk of death from cardiovascular disease. Okay? We know that half of the people with their heart attacks do not make it. And oftentimes we have to wonder about uncontrolled high blood pressure in those death cases. We used to say that 140 was okay for blood pressure. It's not. Your blood pressure has to be less than 120. So 118, 119, 120. It is elevated if it's at 120 to 129. And it is stage 1 high blood pressure if the blood pressure is 135 over 85, for example. A lot of us don't realize this, and many people have high blood pressure that is uncontrolled for many decades before they finally get care. So, what are the conditions that lifestyle can address? All of the cardiometabolic conditions that we're discussing today can be positively affected by a lifestyle approach that is without medication. In addition, inflammatory conditions and chronic pain, chronic fatigue, autoimmune conditions, there are other conditions besides the heart-related diseases that can also be helped by lifestyle. We do focus on addressing the root cause. Sometimes there's behavior change related to this because of habits that have been ingrained that aren't supporting the health. So partnering with a lifestyle intensivist really means having a health coach, a health guide that happens to be a medical doctor and an expert at reducing or reversing disease. Okay. Let's take a look at another case of this 60-year-old man with high blood pressure, high cholesterol, and obesity who wanted to get healthier. He was already on blood pressure medication at the time that he came in with his blood pressure of 190 over 100. Okay. He was actually 232 pounds with a BMI of 36 and with a very high blood pressure as seen here. And the waist circumference was 42 inches. Advanced labs showed more hidden risk, specifically inflammation that we checked for, insulin resistance that we checked for, activity of laying plaque that we found in him, and a predisposition to blood clots that we found in him as well. So all of these advanced labs that I just mentioned are what's underneath the iceberg, things that he didn't know but were driving his risk even further. What he did know was that he had high blood pressure and high cholesterol and was obese, but those I consider the tip of the iceberg. If you have diabetes, knowing whether there's insulin resistance is important because that also has to be reversed and addressed before the diabetes can be reversed or reduced. So basic labs, I do consider them limited and don't provide the whole picture and can often be helped by having advanced labs that give us a better picture of the situation. So this person, for example, had a blood cholesterol panel that is basic at the top and the advanced at the bottom. So in the basic labs, you can see that the total cholesterol is 193, not too bad. It was even green, but the LDL was 121, which was elevated in yellow. But advanced labs showed very sticky particles that tend to produce plaque and that tend to stick to the lining of the arteries. So that is called a B pattern, which we call dangerous or atherogenic. It causes plaque. We also found active plaque deposition in him, as well as insulin resistance that was severe. So he had a high risk and he started working, and these were his results. After completing his lifestyle therapy over the course of many weeks, he did shed a total of 39 pounds with coaching, as I mentioned, one-on-one. This is every week. Like this in the previous case that you saw, he went from 232 down to 193. Visceral fat dropped from 18 to 13, and his blood pressure improved to 122 over 78. This is without adding extra medication, and he actually was able to come off one of his blood pressure medications. In addition to all of this, his BMI went from 36, if you remember, down to 30, and his labs showed the best improvement of all. Remember, I mentioned that he had very undesirable, sticky, dangerous cholesterol particles? Well, after his lifestyle transformation by nutritional guidance, he not only had a perfect looking basic cholesterol, but the advanced cholesterol also looked better. He went from having an undesirable to having a desirable, very healthy, fluffy particles that don't stick to the lining of the artery. This is what you want. Not just a drug to drive down the basic cholesterol, but to begin to produce healthier particles altogether. Lifestyle is what can give you that. So the insulin resistance improved from 89 down to 34, and normal is 30. And by the way, he's no longer insulin resistant today. I continue to follow him. He was close to becoming a diabetic with an A1C of 5.6. That reversed down to 5.3. And so all of his issues that were lifestyle related were solved: high cholesterol, laying plaque, blood pressure, obesity. He had some nutritional deficiencies, energy levels improved, and insulin resistance improved. So I wanted to encourage you, if you've never heard before of lifestyle medicine, this is your introduction. And by way of an intensivist who has the sole work of reversing and reducing disease as a lifestyle doctor. So one person said many, many moons ago that the doctor of the future will give no medicine, but will involve the patient in the proper use of food, fresh air, and exercise, where we are here today. And using lifestyle medicine, we are able to do that in our practice. As an intensivist, I mentioned that I work intensely with people week by week. Behavior change takes a lot of conversation, understanding, light bulb moments, and a transformation that is internal and deep to the individual. I love that work. It happens to take a long time, but the results are lifelong and it's worth it. By long time, I mean the sessions are at least an hour when I conduct them. And they may be a little bit longer than that, but over the course of 12 weeks and 12 hours, an individual can learn and be empowered and own their health, not just have to learn how to take a pill, but how to navigate in life, holidays, family events, vacation, travel, and still keep the health that they received during their journey. So expert guidance will give you an effective plan. That's the most important. A lot of people have the motivation and they want to take action, but don't have an effective plan. So that piece is important. The journey has to be consistent. at the beginning of the year, a lot of people with motivation begin, and by March, they're done. Their gym membership is dusted over, and they actually aren't consistent in their journey anymore because it's difficult without accountability. Drugs are not a part of our process because we're using foods and movement and the pillars of lifestyle, as I mentioned. But it doesn't mean that some people won't have a use for certain drugs. And because it is learning, the investment is always for the entire future. This person in this example is today continuing to improve her health and fitness every year, despite us having had a journey together years ago. So, optional chronic diseases might include obesity, high blood pressure, cholesterol, and type 2 diabetes. And knowing your numbers would be a great way to begin to see where you fall in this scenario and finding out whether reversal of disease could be right for you. So, healthy transformation is a process. It's not a pill that you take and it's not a one-time fix. It is a process over many weeks, but the transformation is lifelong. I want to thank you for your attention. I hope this was helpful and empowering to you. I hope to see you all online. You can reach out to me, let me know you are reaching out from New Bethel Missionary Baptist Church, and I can be reached at lifestylemedicinesarasota.com. And this March is actually National Nutrition Month. And as a result of my usual weekly activities every month, I am doing a 6 week nutritional reset for anybody who's interested in seeing what this is like on a weekly basis. It is free, it is for the community, and you're welcome to join us on Tuesday nights beginning March 24th at 7 p.m. And I'll have the registration link to Mrs. James so that everyone can participate if you're interested. But I want to encourage you to take the health portion of your journey in your own hands. Disease, sometimes we can't do much about, and we have a disease care system that is supporting us in our disease. But your health, each of us has a personal responsibility to uphold, maintain, and improve our own health. And that's the part of the journey that I want to partner with you in. And I want to encourage you to start looking at your health as your own personal responsibility. Thank you so much and enjoy the rest of the conference. And may you have a wonderful and very healthy 2026.